So my name is Bill Wertheim. I'm currently the interim dean of the Renaissance School of Medicine. I've been here for 26 years. I'm a general internist by training, and I've held a lot of positions around the School of Medicine, including a longtime faculty member in the Department of Internal Medicine. I was the director of the Internal Medicine Residency Program for many years. And I was also the Vice Dean for Graduate Medical Education before I assumed my current role a year ago. I like the energy and willingness to innovate that people have here. The fact that it was a young institution really made me feel like people were willing to try new things and consider new things and get rid of things that didn't necessarily work very well. So it felt like a very vibrant place to work. And that's another thing that I've continued to find through my 26 years here. Medical student experience has changed a lot over the last 26 years. Stony Brook has always been a kind of place that has valued and taught interdisciplinary education to the medical students. They've always tried to make those connections between basic sciences and clinical sciences, among clinical sciences, but I see much more of that heightened now. The way the curriculum has been redesigned, it really enhances that connection that students are able to make between the science that underpins the care that they deliver to patients and the care that they do deliver. Also, I think that the way the curriculum is designed now is much more interdisciplinary. It brings together different aspects of care and tries to help the medical students understand that the care that they're going to deliver is going to need to touch upon a lot of different areas. The other thing that I've noticed over the years is that the students get more training and more education in how to communicate best with patients, how to help make partners out of patients in the care decisions that they have to make, and how to understand how the cultural backgrounds that our patients have relate to the kinds of healthcare decisions that they're facing in everyday medicine. Those are things that I really think that have developed well over the last 26 years. The physician of the future is really going to be able to understand much more about looking at large bodies of data and applying that information to their patients. And that's something that I think needs to develop over time. The physician of the future is going to need it to be able to quickly and accurately assess the value of new drugs, new technology, and decide whether those things are worth incorporating into their own practice for the benefit of their patients. And I think that the physician of the future is also going to need to learn how to leverage new technology and new tools for the benefit of that patient relationship. The things that I think won't change are the ability of the physicians to communicate well with their patients, to get them to be partners in their care, and to serve the communities in which they're practicing so that the patients overall and the communities have better health going forward. So I think that there are things that need to continue to change in those directions, at the same time holding on to that sense that we need to be able to weave in all of these different threads into medicine and create that kind of interdisciplinary education, as well as valuing and prioritizing physicians' abilities to communicate with people in general. What I think is a core value and where I'd like to really focus a lot of energy is in reducing the debt burden of our medical students. We know that medical students across the country have a lot of debt. We know that physicians are blessed with the ability to earn a good income after they become physicians, so it helps to offset that debt. But what I think is not understood well is the fact that many people from backgrounds who are lower income or from groups who are traditionally underrepresented in medicine are dissuaded from even considering a career in medicine because of the size of that debt burden. And if we can do more to offset that debt burden, we can bring people from lots of different communities that we serve in Suffolk County, in New York State, across the country. And we know that people respond better to physicians who come from the communities that they're in because they relate to them better. And that helps their overall health. So if we want to improve the health of America, I would like our school to represent all of those different communities in our medical school classes. My favorite part about being dean has clearly been being able to interact with the students. Regrettably, because of COVID, it's not been as much as I would have liked because of some of the restrictions that we've had to gatherings. But when I have been able to do it, it's been by far the most enjoyable part of being dean. The other thing that I really think I should mention that I've enjoyed about being dean is the ability to have an impact on education, on the research that we do as a school. It really feels very satisfying to me to know that I've played a small part in enabling someone to be able to get a grant that they might not have otherwise gotten, or enable a student to have an experience in a branch of medicine or looking at things in a certain way that they never would have considered before. And the degree to which I've been able to help enable that is enormously gratifying. There's a few things that make the education here unique. One is the enthusiasm and the willingness to innovate amongst the faculty. I think we have a very creative faculty and a faculty that's really very interested in making sure that the student's experience is as good as it can be. And that includes taking the students' opinions very much to heart when they're shaping and crafting any new change that they're going to make. So that's number one. Number two, I think the setting of the medical school being really enmeshed and part of the university is to its benefit. There are other departments, there are other fields that the students can help learn medicine from, and they too can take part in it. I'm impressed, for example, by faculty from the School of Medicine, residents from the School of Medicine, and sometimes students from the School of Medicine who take classes and sometimes teach classes in other schools around the university. And to me, that speaks to the value of this kind of interdisciplinary perspective and the value of having the school really as part of the university. So I think that those are really great things. In addition, I think that our clinical education for our students is outstanding and creates the kind of environment where students feel comfortable learning, feel empowered learning, and are able to really learn what is important to them. They're able to look at their own outcomes. They're able to be judged on uniform standards. We utilize our Clinical Skills Center, for example, and lots of sometimes technology and sometimes simple direct observation that makes sure that they really come out at the end of their 4 years with a degree that is second to none. COVID has definitely had an impact on our students' education. In the early wave of COVID in 2020, we really had to shut down all of our experiences, which was very, very difficult for the students. And what was interesting is that the students who were to graduate in 2020, we offered them the opportunity to graduate them early, and work to help out taking care of patients in the hospital. An enormous number of students took advantage of that opportunity, and that to me showed their dedication and their commitment to the care of patients. It also turned out to provide them with a terrific experience in providing care, particularly in a situation that really every doctor has to face. We don't always know all the answers, but we still have to make decisions on behalf of our patients. And I think that was a really powerful lesson for that group of students. We've gone back to in-person teaching, and even though it's been a challenge, thankfully with vaccination and testing, we've been able to do that. But what I also see amongst these students and what I see in terms of their education is the reminder that as we learn more about medicine and we feel like we perfect the care of different diseases, there is an enormous amount that we don't know, that we have to learn how to contend with. And to me, I think one of the most important lessons of COVID is that we need to teach our students the ability to think about problems, come up with the best solutions, take opinions and facts from other places that are also trying to struggle with these same things and incorporate them into practice. It's been an enormous privilege for me to be able to be the interim dean of the Renaissance School of Medicine for this past year. I'm very grateful to the university for offering me this opportunity, and I'm very grateful for the students for inspiring me to do whatever I can to make their education the best that it can be.